Is it one that we can recheck? Is it one that we can repair, make the dog well? Is it one that the tooth has to be removed? Or is it something that we have to refer? And if you can classify it in all those four little buckets, then it really makes dentistry just so much easier to understand. And after the seminar, if you have a case on the table, or if you have a radiograph and you don't know what to do with it, feel free. I'll give you my email and my cell phone. Feel free to email me anytime, any X-rays. There's no charge for it. I'm happy to opine on them. And if you're in trouble during a case, you could also always call me. All right. So for the recheck, it's you want to make sure that you're rechecking the animal that needs to be rechecked. And for that one, there are certain criteria. Is the lesion that you see, is it a functional or a non-functional lesion? If it's functional and the animal's okay with it, so even if it's wrong and even if it's abnormal, but if the animal's okay and it doesn't hurt, then just leave it alone and recheck it. But if it's non-functional, so it's the teeth are in the wrong place and they're interfering with each other, or they're making holes in the gingiva, then you have to actively treat. Then you consider if the lesion that you see is progressive, which many feline tooth resorptions are, even though they're not painful at that time, but it's getting to that point that they're going to be exposed to the oral cavity, you want to actively treat. But if it's non-progressive, like certain diseases that just stay there, that aren't going to really cause any problems, then you can recheck it. And then last goes for painful to actively treat versus non-painful. And that winds up being a real important concern. So if you flip the lips and if you see an inflamed area on one side of the mouth, that inflamed area is painful and it's discomforting for the animals. We've all had canker sores. We've all had lesions on our gingiva right after sometimes some dental work. And it's troublesome. Sometimes it's really painful. And animals have the exact pain response that humans have. They have the same nerves that go to the same place. Their anatomy of the teeth are virtually exactly the same. Enamel is a little bit thicker in humans than animals, but a lot of our fractured teeth and worn teeth have worn enamel that can expose dentin, and then it's sensitive to cold and to heat and to pressure. So our job, oftentimes we are the last person that stands in the way of an animal treated or not. So we have to be the advocate for that little animal on the table. And if you feel that it's hurting, then urge to actively treat. So that's the recheck part. The repair part is that if it's repairable and it renders a good prognosis, then that should be done because animals would like to have their teeth. The removing is often what we do most of the time. And that's because periodontal disease is caused by periodontal infections that come in the pockets. And the pockets get deeper and deeper. And the goal of periodontal disease treatment is to eliminate the pockets. And that many times is eliminating the pockets by removing the tooth. So some days, when we limit the amount of dental cases we do to 4 a day. And some days they're teeth all over the place because we've had to extract so many teeth. And it's kind of a shame. And we all should be advocates for prevention right at the beginning, as soon as you can, because there's no really great reason why a Maltese at 4 years old has to have 6 teeth taken out. People at 24 years old that brush their teeth twice a day, they don't have to have teeth taken out. But our animals are micro pet animals, the miniature schnauzers, the Yorkshire Terriers, and the brachiocephalic dogs, the Frenchies, oftentimes have to have teeth extracted because prevention is really not actively promoted as much as it could be. And my key for prevention is not toothbrushing, it's dental wipes. And the dental wipes should be done twice a day, ideally. We're going to have time for questions and answers at the end of this talk. So if you have any, just put them in the chat room and we'll handle them at the end. All right, referring is the fourth R, and currently there are 210 veterinary dentists in the country. And you can, I'll show you the website at the end of the seminar, how you can find one in your area. And I always recommend for you to become friendly with your local veterinary dentist, and on your day off, visit them. And if you have a tough case that you want to learn, see if you can bring your case to the veterinary dentist and watch how they take care of it. And then hopefully you can chalk it up to CE and do the case yourself next year. All right. So let's start with rechecks. These are the types of cases that you would want to recheck because they're functional. Now, even though, ideally, this is where the canine should be. The lower canine should intersect perfectly between the upper canine and the third incisor. In this case, the canine came in behind the maxillary canine, but it's totally functional. Same in this case. It's rubbing a little, but it's totally functional. So you don't have to remove this tooth, because this is something that you can certainly watch, and the dog will be happy for, hopefully its whole life with it. This is another case. This is a overbite, and overbites are never normal. In some breeds, level bites and underbites are normal, but overbites are never normal. And sometimes overbites create situations where the incisors actually penetrate into the upper palate. However, this situation right here is that these teeth are impinging, not penetrating. And you open up the mouth real well and you don't see any big holes in there. We'll see another case later on in the presentation where you do see some big holes that need to be treated. But this is not painful for the animal, and they can go on virtually without any treatment. Here's another situation where you can just recheck, where you have tooth resorption, and the tooth resorption is right here, but it's right near the apex of the tooth, not considered to be painful, and not considered to be very close to the oral cavity, and that's where the pain comes. If there's tooth resorption over here, then it's exposed to the oral cavity, bacteria get in here, and can be very, very painful. Even under anesthesia, these animals chatter. So this case can be followed.